Good morning and welcome to Webinar Wednesdays with SMP. We're glad to have you all with us this morning. My name is Sunny Lawless and I'm the volunteer coordinator for our SMP programs, and I'm going to be your host for this morning. And presenting our information today is Nathan Coughlin and Brenda Mallara, who are both community outreach specialists with our SMP programs. And today, for the December installment of Webinar Wednesdays with SMP, we're going to be talking about Medicare card fraud and scams. During the presentation, you're welcome to type any questions that you may have into the chat, but we're going to hold all of those until the end when we'll open it up for question and answer. There will also be a prize drawing at the end of the presentation. You must have been registered to attend the webinar prior to 10:15 a.m. this morning, and you have to be present in order to win. Now, before we get started, I need to let you know that this project is supported by the Administration for Community Living, U.S. Department of Health and Human Services as part of a financial assistance award with 100% funding by ACL-HHS. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by, ACL-HHS or the U.S. government. So who is Senior Medicare Patrol? Well, SMPs are grant-funded projects of the federal U.S. Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has an SMP program. In Georgia, Louisiana, and in Mississippi, SMP is sponsored by AdviceWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. So we have a quick polling question for you before we get started today. And the question is, has anyone ever called you and asked you for your Medicare or your Social Security number? So let's see, we're going to launch the poll. There we go. All right, if you don't mind, please answer this question for us, yes or no. Has anyone ever called you and asked you for your Medicare or Social Security number? It looks about like half of you have voted. We'll leave it up for a couple more seconds and see if we get anybody else answering. All right. So let's see. It looks like about 33% of you said yes and 67% of you said no. All right, well, I'm going to turn things over to Nathan now, who is going to get us started and let us know about the fraud and scams that can occur with your Medicare and your Social Security number. Nathan?
Good morning, everyone. So many Medicare recipients have reported receiving calls from scammers who claim to represent Medicare, Social Security, or Medicare Advantage plan insurance company. We received many reports of these types of calls on our toll-free hotline number and during our outreach. The caller that calls claims that new Medicare, Social Security, or Medicare Advantage plan benefits are being rolled out. Some callers state that Medicare is sending out new plastic cards and they need the beneficiary's information to send out their new card. Next slide. The scam artists may even have limited information about the beneficiary, name, address, or sometimes even a birth date. The caller may be extremely aggressive, calling multiple times or threatening the beneficiary with loss of benefits. The caller may promise that they can improve the benefits that a beneficiary is receiving or decrease the cost of their insurance. They will say anything to obtain your personal information. Next slide. On the previous slide, we mentioned that the scammers sometimes already have limited information, such as a beneficiary's name, address, and birth date. How do they know so much about us? Let's take a look at some of the methods scammers may use to steal your information. Hacking and data breaches. Data breaches are something that we keep hearing more and more about. Malicious hackers can target organizations that store large amounts of personal data, like banks, email providers, and online retailers, healthcare providers, etc. Once your personal details are leaked in a data breach, they can be sold on the dark web. Scammers might also get information about us through government records. Personal data like criminal records, property owner information, other public health records are freely available. Anyone can legally gather that information on you and sell it to others, including scammers. It's 100% legal. Next slide. Another way scammers learn so much about us is from us. We give away reams of personal data if we participate in surveys and contests or fill out product warranty cards on paper or online. All of this data can be sold to others legally or as part of a scam. Selling survey data is big business, and marketing firms, even criminals, can learn a lot about us. We share personal updates on Facebook. Scammers turn to social media posts to learn more about those they've targeted. If you discard or recycle sensitive documents like bank statements or utility bills without shredding them, beware. Fraudsters can raid your trash to salvage your personal data. You should shred all mail that has your name, address, account numbers, and/or other personal data. Next slide. Now that we've covered how scammers know so much about us, let's discuss what can happen if scammers steal your Medicare information. Here are just a few examples. You can become a victim of medical identity theft. You may be denied medical services or equipment due to a compromised Medicare number. You may have inaccurate information on your medical records, such as a false diagnosis or inaccurate lab results. Medicare may be charged for services or equipment that you do not need or never received. You may be financially responsible for medical services or equipment that you do not need or never received. Next slide. Let's take a look at what you can do to help stop Medicare card scams. Do not answer calls from numbers you do not recognize. Do not confirm your Medicare number or answer yes to any questions. Guard your Medicare card number like a credit card. Don't share your card, laminate it, make copies, or let anyone else make a copy. Don't share your Medicare number with anyone who contacts you by telephone, email, or in person unless you've given them permission in advance. Medicare will never contact you for your Medicare number or other personal information. Don't let anyone borrow or pay to use your Medicare number. Next slide. If you're looking for a new Medicare Advantage plan or enrolling in Original Medicare, remember the following. There is no such thing as early bird discounts or limited time offers. Don't let anyone rush you to enroll by claiming you need to act now for the best deal. And be wary of free gifts, free medical services, discount packages, or any offer that sounds too good to be true. Next slide. Use caution. The Centers for Medicare and Medicaid Services and the Social Security Administration will never call you to update your information or to give you a new card. If you receive a call from anyone asking you to verify your Medicare or Social Security information, hang up the phone immediately. We do not answer any questions from a caller that you do not know. Next slide. Now that you've learned about Medicare card fraud and scams, Brenda is going to discuss the 3 keys to success in stopping healthcare fraud, waste, and abuse. Prevent, detect, and report. Brenda?
Thanks, Nathan. And good morning, everyone. Yes, so next slide, please. The first key is prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. So please remember to treat your Medicare and Social Security numbers like your credit cards. You never give out this information or the numbers to a stranger. Also remember that Medicare won't call you to ask you for your Medicare number. Also, don't carry your Medicare card unless you'll need it for a doctor's appointment. And then keep a record of all your medical visits, your tests, and also your procedures. You can keep them in a healthcare journal, for example, or on a calendar to keep track of these. Next slide. The second key is to detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. You can review your medical summary notice, also known as MSNs, or your explanation of benefits, known as EOBs, from your insurance company. You can also need to know that your Medicare summary notice is mailed out to you by Medicare every 3 months. And if you have a Medicare Advantage plan, you're going to receive your explanation of benefits after you receive healthcare services. Also, compare your statements to those records we just talked about that you're going to keep in a healthcare journal or on a calendar, and look for the following items: charges for something that you didn't get, billing for the same services or supplies twice or more times, and then also services that were not ordered by your doctor. Next slide. The third and final key is to report. If you suspect that you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Sometimes people may be embarrassed if they think they've been a victim, so they don't say anything, but we encourage you to please report it. Here are some steps to report this suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to us at SMP. Also, if you have questions about your Medicare statements, call your healthcare provider or plan. You have a right to know what's going on with your Medicare account. And then if you aren't comfortable calling your provider for any of this, or you aren't satisfied with their response, call us at SMP. Next slide. So sometimes people wondering, how can I give back to my community? Well, you can volunteer to help. And you're wondering, how can I become involved with SMP? So here at SMP, Senior Medicare Patrol, we're always looking for civic-minded individuals to join our fight against Medicare fraud. The benefits of volunteering for our program include gaining the satisfaction of participating in a national effort to empower members of your own community to prevent, detect, and report healthcare fraud, errors, and abuse. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in a bi-monthly webinar and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP program is extremely flexible and is done on an as-needed basis. Volunteers are offered opportunities and have the option to decline if they are not available. They determine how often they would like to participate. We also want to mention that this is a great volunteering opportunity for couples. In the past, we have had couples team up to volunteer, give presentations, and attend community events. If you think that volunteering for SMP is something you might be interested in, give us a call at our toll-free number. We would be more than happy to send you one of our volunteer information packets and answer any questions that you might have about the process. And our number is 1-877-272-8720. Next slide. So here's all the information. As mentioned in the previous slides, our toll-free number is 877-272-8720. You can also visit our website, www.stopmedicarefraud.org, and if you need more information about our program. Additionally, we would like to encourage you to scan that QR code that you're seeing on your right using the camera on your cell phone, and that will guide you directly to our social media platforms, including Facebook. We have Facebook pages for Georgia, Louisiana, Mississippi, and then also a Spanish Facebook page. It'll also take you to our YouTube channel and our podcast called Sip and Learn with SMP, and that's available on Spotify, Apple, or any of your favorite platforms that you may download podcasts at. Next slide.
All right, thank you, Brenda and Nathan, for that information. So coming up for our next webinar Wednesdays with SMP, we're going to kick off the new year, 2024, with a Getting to Know Your SMP webinar presentation. And that's going to be scheduled for Wednesday, January 31st at the same time, 10:30 Central, 11:30 Eastern. And, you know, we're always looking for new topics. So if you think of a topic that you feel, you know, we need to cover, if there's something out there that we've missed, many of you come every month, and we definitely do appreciate you joining us each month. But if you have ideas for other topics, please send us an email and let us know. All right, so coming up next, we're going to do our prize drawing. And as I mentioned before we started, you had to be registered to attend by prior to 10:15 this morning, and you do have to be present to win. Let me find the prize wheel. There we go. All right, we're going to give it a spin. Let's see, it looks like Miss Peggy, but I don't see her on. So we'll go ahead and give it another spin. All right, it looks like Miss Sandra Harrell, but I don't see her on here. So we're going to go ahead and try it again. Sherry L. All right, I'm sorry, you guys. We had a lot of people registered for today, but it doesn't look like a good many of them haven't made it. So I'm going to have to remove their names, and we'll just keep spinning until one of you wins. Let's see, Janet M. Nope, she's not here either.
Looks like Elsie is here.
Miss Elsie, she's here. Yes, congratulations, Miss Elsie. You are a prize winner this morning. So I will be reaching out to you a little bit later, and you will have your choice of either a $25 Walmart or Amazon e-gift card. So I'll reach out to you a little bit later to get that information so we can make sure we get you your card. All right, let me get us back to our slides. There we go. All right. Well, before we wrap up today's presentation, I do want to open it up to questions. So if you have any questions, please raise your hand and I'll unmute your line and you can ask. I'm not seeing any hands raised. Well, if you think of something later on, you can always reach out to us by email or give us a call at our toll-free number, and we'll be happy to assist you. But this will conclude our presentation today on Medicare card fraud and scams. You will be receiving an email a little bit later with a link to a short survey, and we would appreciate it if you would complete the survey just to let ACL know how we did today. I've also included it in the chat before we got started in case you wanted to go ahead and save it and complete it now. But we do appreciate you all joining us for this final webinar Wednesday of 2023. I wish you all a happy holidays, and we hope to see you again in the new year for when we kick off our Webinar Wednesdays presentations on January 31st. So thank you to our presenters, and thank you for attending. Have a great day.